This is a Master's of Health Sciences in Medical Genomics, fundamentally based in doing coursework, project work, and engaging with practical skills that will help students as they advance into their professional careers.
Currently, there's a real dearth of trained professionals capable of interpreting genomics data and conveying this in layman's terms to either patients or to the public. The M.H.Sc in Medical Genomics program will provide medical trainees, research scientists, and laboratory professionals with the theory and practical knowledge that's required to really incorporate genomics data into medical practice. Our faculty, fellows, and students are highly acclaimed for pioneering seminal advances in some of the most exciting areas of modern medicine and clinical practice. We have over 100 faculty members, including luminaries, who are at the forefront of diverse fields that have a profound impact on human health. We have unparalleled expertise in genetics, genomics, and molecular medicine. The M.H.Sc in Medical Genomics consists of a core set of lectures, also of discussion and project-based courses over a 2-year curriculum.
One of the things that makes this program unique is our really engaged curriculum. Advanced Human Genetics is going to focus on bringing our entire cohort with their multiple backgrounds and their different educational streams that they're coming in from up to the same level, and making sure that everybody can engage with genetic dialogue in the same way. So we'll be focusing on how genetics and genomics work together to contribute to human diseases. Biological statistics will focus on engaging with how statistics are related to interpreting and analyzing genetic and genomic data. Genomics methodologies will focus on assessing how genetics methods and genomics methods play into creating diagnosis and prognosis in the clinic. And we'll be focusing in the first term of study more on classic methods, and in the second term of study more on next generation or very cutting edge genomics methods. Communicating genetics information is going to focus on engaging with genetics information such that students are able to write, read, and speak about genetics to a wide variety of audiences. So for the laboratory professional stream of students, this is going to be really important in building cohesive, coherent, clear lab reports. For our clinical students, this is going to be really important in their clinic. How do they engage with patients? And for both streams of students, how do you speak about genetics and genomics outside of work? How do you talk to the public about genetics and genomics? Ethical, legal, and social implications of genetics and genomics is going to focus on thinking about how bringing genetics and genomics to the forefront of healthcare and into the clinic comes with some ethical quandaries. And we have to think about how the legalities of patient privacy and identifying secondary findings play into how clinicians and lab professionals engage with their professional work. Future Directions in Genomics is going to be a highly cutting edge, highly engaged, and highly dynamic course. It's going to be broken into modules so that students can stay right at the forefront of what the technology looks like, what the implementation looks like, and how things are moving into the clinic right before they leave the program. The capstone practicum is the first and only time that our 2 student tracks will really diverge in any way. So our clinical stream students are going to engage in a practicum in patient management, which will have a clinical setting component, and our laboratory professional stream students will engage in a practicum in modern genomics, which will focus on generating, analyzing, and interpreting genetic and genomic data. The clinical stream students who entered into our program with some medical training will enter into a practicum in patient management, and this will be an opportunity for them to engage with what they've learned in the rest of the program and get some experience interacting with patients. So there will be some clinical rotation components to this practicum, and they'll really be focusing on engaging with genomic data in the clinic. So learning how to interpret genetic test reports, how to translate that into some patient accessible rhetoric, and how to distribute that information to their patients. The laboratory professional students who entered our program after their BSc was completed will be engaging in a practicum in modern genomics. And so this is where they'll get to use what they've learned in the rest of the program to start for the first time really generating their own genomic data, learning how to analyze it, and learning how to interpret it. And then the overarching goal will be to use that data to identify some overall clinical applications for what they've learned. So they'll be learning how to generate their own test reports, how to distill the genomic data that they've generated into some really relevant clinical, diagnostic, prognostic information, and then how to draft that into a really coherent report that can be accessible to, for example, clinicians.
Students completing their bachelor's and interested in careers in research or in medicine, clinical practice, or genomics technologies will all be ideally suited to this program, and this program will enable the launch of their successful careers.